I think it's sort of this perfect storm in healthcare of somewhat, hubris, ego-driven presumptions in some, not all. It's very presumptuous to say, well, I can't see what is causing your problem, so ergo it doesn't exist.
Within a matter of months, Hannah had lost 36 pounds and was in an excruciating amount of pain. We were visiting the hospital frequently, within 1 to 2 times a week. We were not getting any direction to a diagnosis at that time, and there was a lot of diagnosis of mental and behavioral. They always would say, Hannah, your mind is stronger than your body, and if you really wanted to get better, you just have to put your mind to it. Hannah expressed to us often that nobody believed her, and that if this was going to be her journey and she had to continue to suffer like this, she was okay to be done with her life.
POTS, or postural tachycardia syndrome, is a form of chronic orthostatic intolerance. There are symptoms related to standing, that's the orthostatic part, and then there are other symptoms related to autonomic nervous system dysfunction, including gastrointestinal, urinary, as well as headache and nausea, vomiting, that can be all related to the orthostatic challenge. There are many patients, because it's not a rare condition, waiting to see a very small number of specialists.
In kids and adolescents, it's a heart rate increase of 40 beats per minute or more, specifically on head-up tilt table testing, which is something that's not available clinically to most of us. And in a clinical practice, it's your patients who are tired, dizzy, fatigued are commonly reported symptoms. Near fainting or fainting, oftentimes they will talk about exercise intolerance. Little things that used to be easy, walking up the stairs, are now really uncomfortable, associated with heart racing. If we kind of lump things together, a collection of symptoms that feel awful when being upright, being active, and better with rest.
Many of them are thought to have normal physical examinations, so the assumption is that they're making stuff up. But if you do a careful physical examination and you measure their heart rate and blood pressure response to standing, they're not normal at all. This is not a random set of symptoms like you'd get in somebody who's making stuff up. It is what I call a monotonously consistent range of symptoms that you see from a kid from Utah or Maryland or New York or Canada.
We didn't know what doctors to see, and all the ones we saw could only focus on one problem, try to fix my headaches, and just all focus on something different. And so they were telling us to do different things, so nothing really matched up at first, and so it was pretty frustrating.
We had one physician tell us, we are inundated with you patients. We can't deal with all of this. You've got to at least only give me 1 or 2 things. I had one get frustrated and say, I can't even finish my exam because he can't stand up. Why won't he stay up?
POTS is a disorder of inadequate blood flow. One of the best ways to think about it is the heart can't pump what it doesn't get. So when patients stand up, there's what we call a loss of blood flow to the heart, and then the heart doesn't pump that, and it results in a drop in cardiac output about 30% to 40% on average. And then the rest of the body has to make do with what's left. So the brain is underperfused as well as most of the other organs. So that explains why they have so many symptoms.
POTS is associated with a very poor quality of life. In different studies, it's been comparable to the quality of life we see in patients with end-stage heart failure, end-stage chronic lung disease. So, these fairly big, dramatic conditions, it's been comparable to patients on dialysis.
At the children's hospitals, it was awful. It's absolutely awful. I've never been treated so poorly in my life. I'd be in the hospital for days because I was screaming in pain, and obviously something was wrong. No kids crying and screaming nonstop. And I would say, I just want to give up. I just want this, to be over with. They immediately assume I was just suicidal. Or, she's just crazy. She would be better off in a mental hospital. My mom would be rushing me to an ER, and we'd call ahead and be like, okay, this is her files. This is what she has. And they'd be like, sorry, she's too complicated. We don't want to see her.
We had one incident where we had a doctor's appointment,
And she walked in with judgment immediately and stated, "What are you doing? This needs to stop." What was once days turned into weeks, turned into months, turned into years. It was critical we found someone that would really hear us out and listen, because I was watching her lose hope.
I'm so done. I just don't feel loved anymore. I just have this huge hole in my heart. I'm just worn out from all this pain and not being better. I just really want it to be over.
On one end, there's that sort of dismissive behavior from ego, and then on the other hand, there's this pressure of see more patients, you don't have the time, and so you're trying to solve a complex 1-hour problem in 15 minutes.
If you ask the questions, you find out there's lots of things. So that's the difficulty is our U.S. healthcare system really isn't built for spending time with patients and doing what works best. The National Institute of Health found that 75% of all diagnoses can be found with just interviewing a patient. The next 15% is found through a physical exam, and only 10% of diagnoses are through testing. But what do we do here in the U.S. medical system? We just test. And these tests statistically only find the answer less than 10% of the time. So 90%, they're normal. We've kind of become this instant, well, that test is normal, therefore there's nothing wrong with you, therefore be on your way.
When people are told that there's nothing wrong and they're dismissed, the modern term is being gaslit, not listened to and not believed. That's really detrimental. There's also a fair amount of medical trauma that occurs, and people will become phobic of going to doctors. There's a lot that's wrong with these folks. It's not a psychosomatic disorder. And that's, I think, a holdover, a concept that has still interfered with the ability of these kids to get what they need and what they deserve. These kids are not trying to fool me. They're not trying to make excuses. They want to be in school. They want to be with their friends. This isn't a don't want to go to school phenomena. When you look at their health-related quality of life using standardized questionnaires, the kids who have these conditions are often worse off than children with well-described chronic health impairments like cystic fibrosis, diabetes, and even sickle cell disease. They get to school way less often than these patients, not because they don't want to get to school, but they can't get there. So if we should be treating children based on the level of functional impairment day to day, we ought to be devoting way more resources to these patients than are currently the case.